Hair is definitely one of the most important components in the life of a modern woman. On today's episode, we bring you experts who will give you tips and advice on the most effective procedures to restoring your hair before you seek that backdoor treatment. Thank you for joining me right here at the Southern Sun Mayfair Hotel. My name is Sarah Danuteshna, and this is the Skin Therapy Show. Once again, thank you so much for joining us at the Skin Therapy Show. I'm your host, Sarah Danuteshna. Joining me on set today is a hair technician, Mrs. Hope Wenyika, and a hair trichologist, Mr. Stephen Omolo. Welcome to the show, guys.
Thank you.
Really nice to have you for the first time. Kindly please just introduce yourself to us and tell us what you do.
Okay.
I will start with the lady, Hope.
I'm Hope Wenyika.
Yes.
I'm a hair technician, and I'm currently training at Ashley C and Beauty Academy.
All right,
Yes.
great. Stephen?
I'm Stephen Omolo. I'm a clinical trichologist. I currently do consultations at Med Health Solutions here in Nairobi.
Okay.
Yeah.
Stephen, what does the hair trichologist do?
A hair trichologist is just simply somebody who's gone to school to learn about the science of hair, the disorders of the hair and the scalp, and how to treat them.
How to treat
Yeah,
them?
that's basically it.
Okay.
Yeah.
Hope, what are the most common causes of hair loss?
The most common causes of hair loss are the ill practices that are done to the hair, which results to something we call traction alopecia. Like, for example, most ladies put on weaves and hair braids, and if they're done too tightly, then it causes excessive strain on the hair, on the hair strand, and this leads to traction alopecia. Also, harsh use of chemicals. A lot of people are doing chemicals, so if they're not done right, they may lead to hair loss as well.
Okay. Hope, I'm sure you're going to agree with me because most of us ladies, when we are relaxing our hairs, we tend to, feel like when it's starting to itch, you give it just a few more minutes so that it can come out well. Is that the right way, or what is the right time for your hairdresser to wash off the relaxer?
Okay. You see, chemicals, they have a pH level,
Exactly.
which is totally different from the pH level of the hair. The normal pH level for hair is 4.5 to 5.5, but for chemicals is above 9, which is a very strong alkaline.
Yes.
So when the hair is done with a chemical, the hairdresser is supposed to know. When you feel the itchiness, that's not an indicator that the relaxer is well done. So the stylist should be able to know that it is now time, the hair is completely done.
Yeah.
There are some tests that they usually perform, so they're able to know.
What are the most common causes of hair loss?
Actually, that question depends on race. Like for us Africans, you find that our ladies are losing hair more due to traction, the way people handle hair. Yeah. For example, let's say if you go to Caucasian or Indian or Asian hair, when you go there, you'll find that men are losing hair more than ladies. Yeah, due to genetics. Yeah, but when you come to us Africans, you find that ladies are losing hair more than men. Simply because of the practices that we do due to management issues. Our hair is genetically very curly due to the strong disulfide bonds that are found in your hair. So it makes it very difficult to manage. Why? Because the sebum usually is supposed to travel up to the tips of the hair. But in our African hair, because of the curly nature, the sebum is not able to travel up to the tip. So most of the time it is very dry and so at times probably scaly. Yeah? So that makes it very different. So our ladies tend to get ways of easy management of this kind of our type of hair. Yeah?
Okay.
Some go to braids because braids are easy to manage. You just wake up and you go. Some do wigs, yeah, but I would say braids is the main culprit. Let me just say something about the hairline.
Yes, please.
Genetically, our hairline, hair on the hairline is genetically very weak. Yeah, braiding is one of the culprits that is responsible for a lot of traction alopecia that we see around. So, for instance, when the hair on the hairline is put to a lot of traction over a prolonged period of time, but there are ways you can do it in a gentle way so that you don't really interfere with the hair on the hairline. Like, for example, when you're doing things like braiding, you can give your hair breaks. You can braid for a month,
in between.
Yeah, then rest the hair, do some other less stressful styles, just to give the hair time to recover and relax.
Okay.
And even braiding, there are braids that are very light, and are not that heavy on the hair. So when they're very light, also there is less strain on the hair. Secondly, the person doing it. You see, if you go to most salonists, the hairdressers will always try to do a very good good job on the hairline by actually picking up all those hairs on the hairline, the baby hairs, so that it looks neat. But I will say it should be the other way around, They should actually leave those baby hairs. Somebody can just apply some oil, let them sleep there, and then do the braids on the more mature, thicker hair, just like 1 or 2 centimeters, behind the hairline.
And I'm sure you've also seen this, since you're also in the salon business, that nowadays when people are, putting on weaves, they're using glue. Does that also affect hair loss in any way?
You see, what happens to the glue is that it really sticks on the skin around your maybe the forehead or the area, and then it also sticks on the hair. So the problem comes when this glue is being removed. You see, as it is being pulled out, unless it is done very professionally, then maybe there is less strain on the hair. But when it is being pulled with excessive force, that is not right for the hair at all.
What is hair transplant?
Hair transplant is basically transferring hair, we call them hair follicles, from a donor area to a recipient site. Donor area is where you have good hair, good healthy hair. A recipient site is actually where you're losing hair, or your hair is thinning, or you don't have hair at all. So it is basically, in simple terms, that.
Can you get a hair donor, like someone else to donate the hair to you? Or how does this procedure go?
Actually, many people have come in and asked me that question. But the answer is, it's basically impossible.
It has to come from your body.
It has to come from yourself, from your body. So you become your own donor. That's why we say you must have enough donor area for you to qualify as a hair transplant patient.
Steve, just before we started the show, you were telling me that one of the things that you do is reviving the hair. Now, by saying that, especially someone like me who's been struggling with, foreheads and whatnot, does it mean that you have the capabilities of growing hair where it was not growing before?
Yes, it is actually very much possible. We've done it before. And actually, when you come to the clinic for consultations, the most important part is to determine why you're losing hair or why your hair is falling. So once we know that, we discuss with you the possible treatment solutions that are available currently. One of them is hair transplant. Actually, we have done transplant where there was no hair before. We usually say some ladies have prominent forehead.
Welcome back. You're watching the Skin Therapy Show. Now it's that time that it gets very exciting, especially for me, because we've got Stephen Omolo, who is a hair trichologist, and our lovely Shanice, who's the model, who is going to go through the process of hair transplant. And I am more than willing to see what happens, see if I might consider it when I age and I lose my hair. Well, not for everybody. Of course, thank you so much for being with us.
All right.
And how long, maybe we should just start. How long is this process going to take before you give us the basics?
The procedure usually takes like between 3 to around 6-7 hours, depending on how big the area we are doing the transplant is. But today the area is not so big, so it might take us maybe 3-4 hours.
And which area? Should I assume it's the hairline area?
Actually it's the hairline area. As you can see, she's lost a little bit of the hairline on this side, and also on this side as well. You can see she's lost a little bit. So this is going to be our recipient site. So what we usually do is that when you come for a hair transplant procedure, the first thing we do is we do assessment. We assess the donor area. We find out what's causing you to lose hair.
Maybe slowly, which is the donor area?
So usually the best donor area is usually at the back, at the occipital region, usually below the occipital bone, Usually say God gave us our best hair at the back area. It's usually you rarely lose hair at the back.
Alrighty, without further ado, I think I will step aside so that we can see what it is that you do. It looks very complicated, but I know we will understand better at the end of it all. So please, Stephen, take it away.
Okay, so the first thing we're going to do, Shanice, you're going to shave a little bit of your hair. Okay. After that, we'll come and draw the hairline. Okay. So that you agree with it, then we proceed. Okay. Let me just shave. So you can hairline is actually well defined, so I'll just draw a bit of it, just follow it. It's always important to follow the natural hairline of a person. So we'll do a line of local anesthesia in this area just to numb the place well. These are very small needles, so it's not that painful. Shanice, how did that feel? And so it's able to lift the skin up nicely so that it is safe and when I go under and try to remove the hair follicles. Okay, Shanice, you ready? I will turn and lie facing up and start the planting process, yeah? Just come up gently.
So unfortunately, it's a long procedure, about 5 hours to 8 hours depending. And since our show is only 30 minutes, we would really want to show you how it all is done, but we can't. But we, at least Stephen can tell us after this process, how far off are we? You have already removed the hair follicles from the donor area to the beat, you're transferring it to, then what next?
I think the next thing is just now planting the hair. Planting usually is more, take a lot of time because you have to put them one by one. So planting, in this case, it might take us like 2 hours to finish off.
Any special care she should do to her hair after this?
There's a special care. We'll not allow her to wash her hair for the next 2 weeks. Okay. Yeah, she can just cover it. We'll not allow her to touch this area that we have done the transplant for the next 2 weeks. Yeah, and then the other thing, we'll ask her to be putting some water on the hair, on the area that we've done the transplant, just to keep the transplanted follicles moist. Because when they are moist, that's how they are able to feed and attract nutrients from the surrounding tissues until they develop their own supply. So that takes at least 2 weeks, yeah.
This is the most intense it's ever gotten on the Skin Therapy Show, and for me it's a lot of information to digest. And of course, Shanice, if she allows us, we can be able to see her in subsequent episodes, the difference that the hair transplant treatment has made when it comes to rebuilding her hairline, which is mostly of her concern right now. And yeah, on that note, we take a short commercial break. We will be right back. This is a Skin Therapy Show. Do stay with us.